specialist in primary podiatric care. And also importantly, she was one of the original supporters of the American Medical Extended Reality Association, put us on the map inside of the metaverse, helping to support kind of our space, which still exists. So with that, I'll give a round of applause for Dr. Ciavarelli.
And for Mark. Thank you so much, Mark, for making this all happen. We really stand here as a part of this because of the work that you did, the foundational work that you've done, for not just for those of us that are here in the room, but for all of the people moving forward that are going to be able to be a part of this organization. So can we give Mark a quick round of applause? So, where are my podiatry peeps? No, there's none? Okay, I don't know. You had anesthesia, so I thought so. I'm Linda Ciavarelli. I'm here to talk today about patient education. I don't know how to forward. Is there like a thingy? Okay. This is it. The big giant green button. Okay. All right, so I think I'm not going to spend a lot of time going over what many of the other speakers have talked about, the benefits of immersive learning, that it's adaptive, that it can be social, that it's experiential. Some of the work that we've done with the AMXRA in social virtual reality, reaching out to people who are already in virtual reality, leveraging trying patient education in that space, being able to reach people there where they already are, bringing the question, can we educate people about their health using VR specifically? We know it's faster, it's better, it's more engaged, it's more focused. For patient education specifically, which I'll be talking about, people aren't looking at their phones. They're not able to check the internet. They're not able to look at what's going on outside. We have the opportunity to really bring patients completely into a place where we want to bring them. And as a clinician, that's something that's always a big challenge. In applications in immersive technology in healthcare, we've heard this even just in this session. We've talked about medical education, simulation and training. When I trained as a surgeon, I trained on cadavers and then on people because that's how we learn. We learn to do this. And I think there is a great amount of opportunity to leverage immersive technology to bring us better in line with some other industries, including aviation, that teaches pilots how to fly and brings them to competency far before they're ever in an airplane. And we should be doing this as well, whether it be with softer skills, harder skill training, and a variety of other applications. And then patient care. There's innovators that are here outside. These companies are bringing, including companies like Applied VR that are bringing direct patient care. We see this now, right? We're moving from the phase of validation testing into commercialization, where we're treating pain, we're treating a variety of psychiatric disorders. One of the places, though, that hasn't been well examined, and there isn't as much information and as much movement, is in patient education. And I'll be talking about that in a little bit. So talking about XR and medication and medical education, there is a wealth of data here. And again, I'm sure you've all had the opportunity. I won't go over all of these. I think my talk's going to end up being a little bit shorter because I don't want to be duplicative, and it is the end of the day, so I understand. XR for patient care, we can all see the untold applications for this, and many other people are working in this space. So how can we use XR to educate patients and engage in them in their health? I'm here, one of the things I really want to talk about today is the connection between health literacy and health equity. Health literacy is truly a universal problem. And I'll put this to the audience. Who among us here has never been, and physicians included, who among us here has never been left a doctor's office visit left a healthcare visit with more unanswered questions? Who among us was maybe unsure of what the provider was saying? Who among us here hasn't been in a position where you've gone to the internet? You know, this is the reality. We know over 94% of Americans get their health information from internet searches, and 80% of people do this directly after a visit. And we see this as physicians. We're pushed to see more and more patients in less and less time. I see patients still 2 days a week. I routinely see 25, 30, sometimes 35 patients a day. This is the reality of healthcare. We have to see that many patients. And so as much as I want to sit down with my patient and explain everything and share all of my knowledge, my 2 decades of practice experience, this is how I think you can best manage your condition, I don't always have the time. So how can we leverage these technological advances, specifically immersive tech, but really any technology, to give patients better knowledge? Some statistics up here, 40 to 80% of people can't recall what their doctor says to them immediately after their visit. And what they understood is misunderstood. So that 60%, that actually is specifically referencing medication information. So we're telling our patients, all right, okay, yeah, take this, okay, here's the prescription, okay, see you later, and we're running out the door, because that's the reality of healthcare. That's how we're practicing today. And so how can we leverage technology to fill that gap, to help our patients better understand, and to give us greater efficiencies as healthcare providers? So, the answer is doctor, do better. Doctor, spend more time with your patient. So, and this study that Boyd looked at, I don't know, has anybody else seen this? That for your primary care physician to do the recommended amount of patient education and care for your average patient load would have to work 26.7 hours a day. Okay, physician, do better. Maybe that's not the answer. Maybe we can use some of this technology to answer some of these questions and to help us create better care for our patients. So why do we care about health literacy, other than the fact that it costs untold lives? Those of us that practice clinically, we see our patients. We see a patient who is newly diagnosed, and in the next room, we see that same patient 20 years later. And we have that opportunity to see that. So where can we step in? Where can we give that patient agency? Where can we give them the ability to affect their health? People want to, not everybody, but most people really want to affect their health. And a brochure is not doing the trick. We can do better. Pamphlets, videos, we're trying. We're drawing pictures. We're pulling out the model. We're showing the video. So why can't we take it a step further? Why can't we leverage immersive tech, put them within themselves, leverage all of those amazing statistics about how immersive technology is better, use that here, give people agency. So health literacy is equated to health equity. So health literacy is defined as the ability to understand, interpret, and act on their health. That sounds like, okay, fine, there's 3 things, but what does that really mean? To understand, interpret, and act, that's a challenge. That's a challenge for all of us, because medical information now is we are so lucky. We live in this amazing age where we know so much. We know so much that there are specialties within specialties within specialties, right? So, and if that's what's happening in the medical community, how can people who aren't there even attempt to understand? This is an incredible challenge. It leads to low equity. So people who have low equity, equity defined as the opportunity to be healthy, which everyone has a right to be. Low health literacy causes increased hospitalizations, increased access to emergency care, use of emergency care service, increased mortality rates, and increased cost. They have lower use of preventative services. People with low health literacy have a harder time interpreting labels and end up with a lower health status. So We talked about all the work that's been done in simulation and training, and that's also been done in direct patient care. So how can we use XR to heal people? There hasn't been that much work done. Now, interestingly, one of the seminal studies was done right here at Cedars-Sinai, Omer Liren in 2017. They did some really interesting work, and this is probably one of the most salient pieces of work where what they did is they took 100 patients who were taking HIV medication, showed them an immersive experience about why they should take their medication, and then looked at a measurable outcome. They looked at CD4 count, which went up, and viral load, which went down, which indicated that patients who were getting this information in this way were actually more adherent with their medication. So think about that medication adherence piece. How critical is that when you're looking at whether or not a patient is readmitted into the hospital? Those patients that you discharge, that we discharge with, I'm not looking at you specifically, we discharge with a stack of papers, and they don't read it, they can't read it, they won't read it. Those people are being readmitted because they're not taking the medication. And it may not, yes, it might be cost, yes, it might be how they get to the pharmacy, but it could also be that they don't understand the importance of taking their medication. I'll be fairly brief here. There's some other work here around diabetic macular edema, just looking at an endpoint of knowledge gains. Very interesting work that happened here. I'm going to fly through a little bit of this. This was actually really an incredibly interesting piece of work, or a study that came out. Wang et al., they created a radiotherapy experience where people could actually go in and have radiotherapy before they had their radiotherapy. And this significantly decreased anxiety, which allowed for greater efficiencies. And again, another study here around hypertension with improved knowledge. So, what am I getting at? I think patient education and immersive technology are a wonderful place for us to be working. Challenges, we know these are all the same challenges that many of us in the industry are facing. Technological limitations, user accessibility, data privacy. I think personally, the thing that we as those of us in technology and those of us in clinical technology working on the kind of thing that you guys are working on what you're working on, Dr. Hart's working on, is systems integration. I think if we're not thinking about the systems that we're trying to integrate into, we are not going to be successful. We have to consider ease of use. We have to consider scalability, and that's I think from my perspective, the next steps that we need to take. Those places where we can be as thoughtful as we can about the end user, and the end user not just being the patient, but the end user being the medical assistant, the end user being the nurse, the end user being whomever the IT group that's in the hospital. This systems integration is critical from my perspective to advancing this technology, not just for patient education, but for XR in general. Looking at future prospects, next gen hardware, accessibility, affordability, and expanding applications. So a couple key takeaways. Obviously, the AM-XRA is awesome. Also, check out the JMXR if you haven't already. We have a revolutionary potential for XR and hardware in healthcare. This specific use case, leveraging immersive technology for patient education to give patients better understanding of their health, is, from my perspective, one of the great opportunities that we have here. I'm welcome to take any questions if anyone has any. I'm all done now.
We have time for maybe like one or two questions. Yep, question.
I think just looking at what we can see generally out in the marketplace and out in the hallway here, that you're right, there isn't a lot of effort being expended on patient education, and you've taken a leadership role in this area. But I want to know, why do you think that is? Why is patient education not getting that much attention in the XR community? Please, what do you think?
Thank you, Laura. I think that's a really great question. If you look at how we educate patients in healthcare, it hasn't been valued from a monetary perspective. There is no code. There is one code that is reimbursable for patient education, specifically around diabetes education. That code pays like $15. It hasn't been valued from a system perspective to the tune of a loss of $200 billion annually lost in revenue annually because of low health literacy. So this is a problem. This isn't, I have got, our interface is what's interesting and new and XR, but this is a problem. And I see Sue Woods here, I'm sorry, I'm gonna call you out, but you've been talking about this for 2 decades, right? And this is something you've been talking about for 2 decades, about how patient education is a piece that is critically missing in healthcare. And I think anyone who wants to know more about that, I can speak about it from a clinical perspective, but we happen to have an expert in the room, so I would suggest that you talk to Sue Woods.
All right, I think with that, let's give another round of applause for Dr. Ciavarelli. Thank you so much.
Thank you.